The landscape of mental health encompasses a vast spectrum of conditions that extend far beyond the commonly discussed disorders like depression and anxiety. Other mental disorders represent a diverse category of psychological conditions that significantly impact millions of individuals worldwide, yet often remain misunderstood or overlooked in mainstream mental health conversations. These conditions challenge our understanding of the human mind and highlight the complexity of mental health care in contemporary society. Dissociative disorders constitute one significant category among other mental disorders, characterized by disruptions in consciousness, memory, identity, or perception. Dissociative identity disorder, formerly known as multiple personality disorder, represents perhaps the most dramatic example within this classification. Individuals experiencing this condition develop two or more distinct personality states, each with unique memories, behaviors, and characteristics. The disorder typically emerges as a response to severe childhood trauma, serving as a psychological defense mechanism that allows the mind to compartmentalize overwhelming experiences. Treatment approaches often involve specialized therapy techniques designed to integrate these separate identity states while addressing underlying traumatic experiences. Personality disorders form another substantial group within other mental disorders, affecting fundamental patterns of thinking, feeling, and behaving that deviate significantly from cultural expectations. Borderline personality disorder exemplifies the challenges associated with these conditions, characterized by intense fear of abandonment, unstable relationships, identity disturbance, and emotional dysregulation. Individuals with this disorder often experience intense emotional episodes, engage in impulsive behaviors, and struggle with maintaining consistent self-image. The condition affects approximately 1% of the adult population and requires specialized therapeutic interventions, including dialectical behavior therapy, which has shown remarkable effectiveness in helping individuals develop emotional regulation skills. Narcissistic personality disorder represents another complex condition within this category, marked by grandiose self-perception, lack of empathy, and constant need for admiration. While popular culture often trivializes narcissism, the clinical disorder involves profound suffering for both affected individuals and their relationships. People with this condition struggle with genuine self-worth, often masking deep insecurities behind facades of superiority. Treatment remains challenging due to the disorder's inherent resistance to acknowledging problems, requiring skilled therapeutic approaches that carefully navigate the individual's defensive structures. Somatic symptom disorders represent a fascinating intersection between physical and mental health within other mental disorders. These conditions involve physical symptoms that cause significant distress or impairment but cannot be fully explained by underlying medical conditions. Conversion disorder exemplifies this category, where psychological stress manifests as neurological symptoms such as paralysis, blindness, or seizures, without corresponding physical causes. The mind-body connection demonstrated in these disorders challenges traditional medical models and requires integrated treatment approaches addressing both psychological and physical aspects of symptoms. Factitious disorders, including the well-known Munchausen Syndrome, involve deliberate production or feigning of physical or psychological symptoms for the primary purpose of assuming the sick role. These conditions highlight the complex motivations underlying human behavior and the lengths individuals might go to receive care, attention, or validation. Treatment requires careful navigation of therapeutic relationships while addressing underlying psychological needs driving the deceptive behaviors. Impulse control disorders encompass conditions characterized by failure to resist impulses that may harm oneself or others. Kleptomania involves recurrent stealing of objects not needed for personal use or monetary value, driven by increasing tension before the act and relief or gratification afterward. Pyromania involves deliberate and purposeful fire-setting motivated by tension relief rather than monetary gain, revenge, or ideological purposes. These disorders demonstrate how specific behavioral patterns can become compulsive and destructive, requiring specialized intervention strategies. Sleep-wake disorders within other mental disorders significantly impact daily functioning and overall health. Narcolepsy involves excessive daytime sleepiness with sudden sleep attacks, often accompanied by cataplexy, where strong emotions trigger sudden muscle weakness. Sleep terror disorder causes episodes of intense fear during sleep, typically occurring in children but sometimes persisting into adulthood. These conditions illustrate how fundamental biological processes can become disrupted, affecting every aspect of an individual's life. Feeding and eating disorders extend beyond commonly known conditions like anorexia nervosa to include other mental disorders such as pica, involving persistent eating of non-food substances, or rumination disorder, characterized by repeated regurgitation of food. These conditions often emerge in early childhood and require specialized treatment approaches that address both nutritional needs and underlying psychological factors. Sexual dysfunctions and paraphilic disorders represent sensitive areas within other mental disorders that require careful clinical attention. These conditions involve persistent patterns of sexual arousal, behavior, or fantasy that cause significant distress or impairment in functioning. Treatment approaches must balance clinical necessity with respect for individual autonomy and diverse expressions of human sexuality. Substance-related disorders encompass addiction patterns beyond typical substance abuse, including behavioral addictions like gambling disorder, which shares neurobiological similarities with substance addictions. These conditions demonstrate how reward systems in the brain can become dysregulated, leading to compulsive behaviors despite negative consequences. The treatment landscape for other mental disorders requires highly specialized approaches tailored to each condition's unique characteristics. Evidence-based therapies, medication management, and comprehensive support systems play crucial roles in recovery processes. However, stigma surrounding these lesser-known conditions often creates barriers to seeking help, making public education and awareness essential components of mental health advocacy. Research into other mental disorders continues advancing our understanding of human psychology and neurobiology. Neuroimaging studies reveal brain structure and function differences associated with various conditions, while genetic research identifies potential hereditary factors. These scientific advances offer hope for more effective treatments and possibly prevention strategies in the future. The impact of other mental disorders extends beyond affected individuals to families, communities, and healthcare systems. Supporting someone with these conditions requires patience, understanding, and often specialized knowledge about specific disorders. Mental health professionals, including psychiatrists, psychologists, and specialized therapists, work collaboratively to provide comprehensive care that addresses the multifaceted nature of these complex conditions. Recovery from other mental disorders is possible with appropriate treatment, support, and commitment to healing processes. While some conditions may require lifelong management, many individuals achieve significant improvement in symptoms and quality of life through dedicated therapeutic work. The journey often involves developing coping strategies, building support networks, and learning to navigate life's challenges with greater resilience and self-awareness. Understanding other mental disorders requires moving beyond stereotypes and misconceptions to embrace the full complexity of human mental health. These conditions remind us that psychological well-being exists on a continuum and that seeking help represents strength rather than weakness. As society continues evolving in mental health awareness, recognizing and supporting individuals with other mental disorders becomes increasingly important for creating inclusive communities where everyone can thrive despite their psychological challenges.